Mark my words, at some stage in the future, artificial intelligence will take over humanity. I have no doubt about that. For whatever positives we have developed on this planet, we've also developed an equal or greater number of negatives. And unfortunately, as I study history, it's usually the bad guys who generally win.
Traditionally, we'd have admin staff, for example, writing our consultation letters. At the moment, in the National Health Service, they're starting to bring in AI that will listen into your consultation and will actually make your consultation letter at the end of your consultation. And there's also the technical aspects. There's a very rapidly developing field. You mentioned, Fred, endoscopy. In endoscopy at the moment, they have AI software that will, while you're performing the endoscopy, colonoscopy, for me, it will actively monitor the colonic mucosa and will detect if there is a polyp there that you may not have seen with a naked eye. And it's also will better tell you the risk of that being a cancer and what type of polyp it is. Okay, so that's just one application in the field of GI. And if you look at every aspect of surgery and medicine, whether it's in the admin side, whether it's in the diagnostic side, whether it's in the triaging of patients, AI is being used. So it's going to change the way we practice.
The aspect of AI that I've encountered probably the most in healthcare has been the use of machine learning. So we're used to dealing with such large sets of data, which are near impossible for human minds to either capture, analyze, make sense of. But now you have these super powerful software packages which can do that in an automated fashion, but also learn from that data set. So the classic description of this is for radiology, where you have a human looking at each scan, reporting the scan, for example, is there a cancer here or not? And then feeding that back into this computer, which analyzes the results, is able to learn what is it on this scan that makes this a cancer, and then reuse that, developing over a period of time as more and more data is input. Eventually, the aim is that it would be automated, but the ultimate aim is that it reduces the risk of human error.
There are AI systems in Alzheimer's diagnosis, and it sparks an interesting problem because with Alzheimer's diagnosis, there are different techniques being developed right now, but I don't think we still have a gold standard diagnostic test for Alzheimer's. What that means is, let's say AI looks at that scan of the brain and then it says, okay, the patient is likely to have Alzheimer's, but we don't know where AI gets that idea from. And so in that sense, we need to trust the AI's decision. That's why people have also developed explainable AI, which is called XAI, so that the AI can explain its decisions. But I think even with that, there are studies being done that if the AI made a mistake and we trust the AI, obviously repercussions are huge.
We have a problem within the United Kingdom is our data isn't very good. Our hospital data. So it's either misreported or it's the wrong things put in. And so the input, if it's flawed, there will be errors. It's not the AI's fault, it's the data that's gone in. So that's number one. Number two, I'm sure you guys are aware, the AI can create errors. That is a big problem in medicine and surgery. If you're relying on something to exclude a cancer, and there's that small risk that it's going to get it wrong, because either it's doing its own thing for some weird reason, or it's got the wrong data, or it's the wrong person that it's been learning from. So I think it's a massive issue. I think clearly regulation is required, but I think it will come back to the same old thing, whereby you'll have to have another doctor checking the AI to make sure it's fine.
In relation to the Alzheimer's study, so a lot of centers are trying to use AI to analyze historic data, scans, medical information to develop predictive tools. So in this instance, it would be if you analyze X number of people and then go into try to predict which one of them will get Alzheimer's. And I think that's a very dangerous path to follow, because generally speaking in medicine, we treat symptoms. And I think if you are, with the exception of certain diseases like cancers, for example, where we would like to predict, who are the higher risk groups or individuals who may develop cancers, particularly in hereditary cancers, and there's well-established screening programs for these in the NHS. But for conditions which are incredibly unpredictable in the clinical course, to tell someone that you've got the hallmarks of developing Alzheimer's in 5 years, I think it's a very dangerous path. I remember when I was a medical student, I found a poster at the hospital where the radiology department was offering £100 to volunteers to have an MRI scan of the brain as part of some study. And I registered for it. It's a 15-minute scan, and I thought I'd get £100 for not doing anything. But the radiologist who was coordinating it refused me. And the reason he gave was that in about 20% of people, they find tiny little dots in the brain, which may be something, may not be something. And if you don't have any symptoms, it's better that you just forget about it. Otherwise, you're in a whole world of panic, wondering what's going on. Most findings in most scans are incidental and of no significance, but the trouble now is that when you find something, then you are quite obliged to chase it to the ends of the earth. If you are predicting what may or may not happen in the future, irrespective of someone's symptoms, I think that's a very dangerous and difficult path to go down.
Yes, artificial intelligence has a scope to help improve the ease with which the surgeon can do the operation. Now, coming to the endoscopy, I've used the software, and there have been studies out there, and most of them show that the AI is as good as experienced colorectal gastroenterologists at detecting polyps. The concept that an experienced gastroenterologist or colorectal surgeon who's doing a colonoscopy, the chances they're going to miss a cancer is quite low. And if they see a polyp, they're going to remove it most of the time. So you have to understand what the benefit is. And I think as an adjunct to certain specific things where there is clear evidence that there is more effective or improves the ease of something, then I agree with it being used. But what I'm seeing is that it's been used as an adjunct where it's not really required. There's no real massive benefit. It's just a cost. I think it'll be in very select situations. That's my personal experience and my personal feel for it going forward.
For artificial intelligence, for modern technology in general, it's there to augment what we do. But it doesn't negate from the fact that you still need the same surgical skill set, a competent doctor behind it to be able to do it. So it may assist in certain things, but it certainly is not probably as good as the human mind at the moment in our profession. As the saying goes, it's not the tool that you're using, but the tool using it.
How would you think we could regulate this development?
I mean, ideally there needs to be international consensus, but I suspect that will never happen. Different countries are in different stages of AI development. Different countries have different financial interests in AI technology. So I don't think we will ever reach international consensus, as with most things. But I do think in the UK we do need some fixed regulation, which is adaptable, because at the same time you don't want to stifle innovation. You just got to make sure that innovation is appropriately used for the betterment of society.
We have very good regulation in the UK, and I think AI in clinical settings should go through the same regulatory bodies that medical products or surgical products go through. For example, I'm thinking of knives, for example. It should go through that type of regulation. It should be checked by a committee of people, and there should be the evidence presented and the cost as well. I think perhaps the problem is that because it's an IT type product, a software product, it at the moment is not really going through these type of regulatory routes. And I think it needs to be treated more in healthcare as a medical product or a surgical product.
Yeah.
Or a drug, for example.
The gold standard for our treatments used in Western medicine are based on good quality randomized controlled trials, and so there's no reason that any other technology which affects the treatment that we offer, or the diagnostics or the management of patients in any way, shape or form, should not be subject to that rigorous scientific interrogation. My apprehension about AI generally is that ultimately it's humans who are creating it. So in my mind, and this might be sort of a more science fiction type fantasy I have in my head, but actually it's only as good as the creator.
The godfather of AI was Geoffrey Hinton. He won the 2024 Nobel Prize in Physics, and he actually expressed similar views throughout different media interviews and also in his Nobel speech, that we need research on how to prevent them from wanting to take control, but also at the same time that different companies, when they start to develop these AIs, what he said was that our safety would not be the top priority.
Mark my words, at some stage in the future, and I can't say when, but it might be in my lifetime, artificial intelligence will take over humanity. I have no doubt about that. And I'll tell you why. It's because artificial intelligence learns from humans, it learns from its creators. And humans over millennia have demonstrated, many positives, but for whatever positives we have developed on this planet, we've also developed an equal or greater number of negatives. Every positive use of scientific discovery or the arts or whatever, there is an equal and opposite negative. A classic example of is understanding of nuclear fusion for peacetime energy use, but then ultimately led to the creation of a nuclear bomb, the most devastating bomb ever created. Similar to AI, which is entirely a human innovation, there is that potential for use in good, but also for, use for nefarious purposes. And unfortunately, as I study history, it's usually the bad guys who generally win.
One of my biggest fears about AI in surgery and medicine is the removal of that doctor-patient relationship, that human aspect. Because we're already seeing it. I'm aware of many private companies for the private healthcare. They're using AI to triage patients. So, okay, the patients will put in their symptoms, and the AI will say, okay, this patient needs this scan or this investigation. It starts removing that human interface, and it becomes very impersonal. And I do wonder if that's appropriate.
I mean, as cancer surgeons, we want to tell patients that they have cancer, this is how we are going to treat it. It's the treatment, a large part of it is actually based on our personal interaction with the patient and the families, and you simply cannot have a machine which replaces that in any way, shape or form. We need to meet our patients, we need to make sure they have a good understanding, and the patient needs to assess us and make sure that we're competent to perform their surgery and manage their care. And you just simply cannot do that with a robot.
And so that's my greatest fear. My greatest fear is you are putting barriers up between the patient and the doctors. And I do see that coming very, very quickly.
We always look at medicine or healthcare, this profession that prioritizes accuracy and efficiency. But oftentimes we might forget about the human touch that is necessary to be a good doctor. That might be the part that AI may not be able to do efficiently. As doctors, we're not just changing people's bodies, but we're also changing their souls. That is, I think, what makes the basis of humanity. And I think that gives us the light to look forward to when having this existential crisis of, it seems that AI could do a lot of things more efficiently than us, then why are we still doing our job? But I think sometimes being human or living is not about the destination that we get to, not about the accuracy, but about how we get there. Sometimes the journey matters more than the destination.